Well, from SARS to COVID-19, there have been no shortage of public health emergencies over the last several years. But how should we respond to those public health emergencies from a legal perspective? Joining me now here in studio is Georgetown University professor Larry Gostin, hopefully to answer that exact question. Thanks for your time this morning.
Thank you for having me.
Let's go back a little bit and start off with public health law and ethics and how that came into existence in the first place.
Yeah, let's start with ethics. We have a history in America of focusing on the common good, what we owe to each other. And we've seen that right through our history when we would, with smallpox vaccinations, through to save food and clean water. And we have this rich tradition that went through JFK, ask not what
you can do for your country.
Exactly.
Yes.
And then Lyndon Baines Johnson, the Great Society, the War on Poverty. And yet today, we've lost that tradition of the common good, and we're all about what are my rights?
Me.
Me, and not what do I owe to my family, to my country, my community, to my world. And the laws reflected that, whereby originally we had a huge understanding in the judiciary of the need for strong public health powers. And fast forward to the current Supreme Court, that is just eviscerating our ability to protect health, safety, the environment, and even issues like reproductive health and abortion.
Right. Were you surprised by the Supreme Court's decision regarding Roe v. Wade, the fact that they waded into that in the first place?
Well, the very sad truth is with this empowered, super conservative majority, their decisions are almost predictable. And they've really decided to own all of the most contentious issues in America. If you think about it, abortion, race, climate change, firearms, the list goes on and on and on. And they really are destroying what we are as a nation, about the idea that we're in this together and we need to protect one another. We need to look out for one another. The court doesn't seem to get that.
Obviously, that decision by the High Court had a huge impact on public health. Are there any other cases that stick out to you with regard to having a large public health impact?
I would name a few. Certainly firearms. We have tens of thousands of people dying of firearms every year in the United States, more. And for most of our nation's history, we didn't regard the Second Amendment as something that applied to an individual right. And now the court is really diminished, if not destroyed, our ability to enact sensible firearm safety. I would also, on issues of public health and climate change, really saying that public health agencies, particularly federal agencies like OSHA, EPA, CDC, don't have those kinds of powers. And the upcoming term, I think, on the ballot is affirmative action. And it's not just college admissions. It also is about our ability to take race into account in vaccination allocation and other kind of measures of equity. So we're really threatened by this current Supreme Court, in my view.
Larry, I could have talked to you all day long, but we do have to wrap it up. Thank you so much for your time today. I sure do appreciate it.
Thanks for having me. I really appreciate it.